Hi, my name is Katie, and today I will be talking about preventing aspiration pneumonia in older adults. What is aspiration pneumonia? According to the National Library of Medicine, aspiration pneumonia is the infectious pulmonary process that occurs after the abnormal entry of fluids into the lower respiratory tract. Individuals affected by aspiration pneumonia, specifically older adults, account for 86.7% due to decreased swallow function. I will be discussing the prevention and or reduction of aspiration pneumonia in older adults. A popular method that has been proven effective is the person-centered approach. This approach focuses on the patient's specific needs and abilities. Another factor to consider is that healthcare professionals provide individualized care based on their knowledge and experiences. Healthcare professionals, specifically speech-language pathologists, administer screening tests to determine if the patient has dysphagia, and most importantly, if the patient aspirates. Based on the results, the SLP may refer the patient for a clinical evaluation, such as a modified barium swallow study, known as an MBS, and or a fiber optic endoscopic evaluation of swallowing, known as FEES. The MBS is the radiographic examination of the pharynx, and the FEES assesses the deglution pharyngeal phase without radiation exposure. Once the screeners and clinical evaluations have been completed, SLPs will provide techniques to the patients and their families that can be used based on their individualized needs. Although prevention may not be possible, there are several techniques that can reduce the risk. The first technique is to change the patient's diet. This technique could include the use of different consistencies, such as using purees, which can reduce the risk of choking, and or not eating spicy flavored foods due to possibly causing heartburn. The second intervention technique is to maintain oral care. This technique is important for individuals who pocket food inside their cheeks and cannot practice good oral hygiene, specifically those in hospital settings. Another factor to consider is for those individuals that experience xerostoma, or dry mouth, due to medications that affect the salivary glands. This factor can reduce salivary flow and increase bacteria. The last technique is an enzyme inhibitor that prevents or reduces aspiration pneumonia and controls blood pressure. Blood pressure control is essential for post-stroke patients due to them being at an increased risk of aspiration pneumonia. Healthcare professional knowledge and techniques can be beneficial to older adults in preventing and or reducing aspiration pneumonia. With the advancements in research and continued education provided to SLPs. Most importantly, healthcare professionals must take the patient's needs and abilities into consideration when determining the plan of care that will be most effective during treatment and maximizing the progress during their time receiving speech services related to feeding. Thank you, and I hope you have a great day.